Hi, everyone. Welcome to the Heart Health Bootcamp. Today, we're chatting with Dr. Joel about testing. Hi, Dr. Joel.
Good day. Hi, everybody.
So, how do I know if my heart's in good health? What testing do you recommend? And at what age?
So there's a lot of misinformation, unfortunately, in my 30 years as a cardiologist. So you've got to do the basics. What's your blood pressure? What's your blood sugar? What's your blood cholesterol? Do you smoke? Do you walk? What's your diet like? Do you sleep 2 hours a night or 7 hours a night? These are basic, important numbers. But you can do all that and also see your doctor and have a physical, get a pat on the back, everything looks good, see in a year, and you can totally miss the boat because you haven't really directly tested this single most important organ that causes more death amongst men and women than any other, that being your heart and your heart arteries. So, your heart is sitting there beating 70 times a minute with 3 arteries on top of it. They're very tiny. They're constantly moving. You can't listen to them with a stethoscope. You can't really get any direct information with an electrocardiogram. And there isn't any direct blood work. But so the sad story, and somebody, Joe or Jane went to the doctor 2 weeks ago, got an A+ on their physical, maybe even did a stress test. And let me just divert there. If you're 40, 45, 50, there is no recommendation to have a stress test if you're a healthy person who's feeling good. Not because it couldn't be helpful, but so many false recordings. You really want to know if your arteries are clean or not, and the stress test doesn't show that. It shows indirect information. So stress tests, still sometimes done in executive physicals, are actually not recommended by the American Heart Association, American College of Cardiology. So you want to have a few extra blood tests. There's something called advanced cholesterol panels, very available, very insurance coverage. There's a blood test called lipoprotein A or LPA. It's a kind of cholesterol that 20% of us have elevated. 63 million Americans. It can be very dangerous to your arteries, but unless you get it checked, you won't know. A test called C-reactive protein, a test of metabolism called homocysteine. Pretty simple. And then, lastly, about 20 years ago, a CAT scan of the heart was developed called a heart calcium CT scan or coronary artery calcium scan. It takes about 10 seconds. Lie down, hold your breath, done. No IV, no injection, no exercise. It's not going to be done in a doctor's office. It's a big CT scanner at a hospital. It used to be about $1,000 plush test because there's very rarely insurance coverage. There's still not much insurance coverage. State of Texas, it's covered. Most states, including mine, it is not, but it's $70 in my state. So I want to know, my uncle, my grandpa, I used to smoke, my cholesterol is 230. Well, not at age 25 or 30, but maybe at age 40, 45, you can ask your doctor, can I get one of those heart calcium CT scans? Will you write me a prescription? I'll pay the $100 or the $70. There's no more accurate way. Recently in the news, people may have heard a little bit about President Trump having a physical exam. There was a lot of discussion about what was his heart calcium score, what did it mean, Sanjay Gupta, CNN, and that's what the test we're talking about. If it's good enough for a president, it's good enough for you.
Absolutely. That sounds great. Just the general blood tests. Is there any value? Is there anything in there that we need to be cognizant of as it comes to heart health?
Yeah, there are for sure. If your blood, you won't know if your blood sugar is elevated, and if you have pre-diabetes, you might wonder because your belly's gotten a little bit bigger, or your diet's deteriorated a bit, or you got psoriasis, which is associated with increased risk of type 2 diabetes and such. Yeah, you have to have the basic blood work. You can't guess your cholesterol. You might be the 1 in 250 people with dramatically high cholesterol on a genetic basis, called familial hyperlipidemia. You won't know what your inflammation level is. If you got a big belly, if you have psoriasis, if you have gum disease, you probably got inflammation going through your bloodstream. That's very dangerous. But even still, your diet may not be working for you. The grains, the dairy may not be working for you. And so you want to get the blood test. You don't know your vitamin D level. I mean, you got to have the basic, and I would say more than the basic, a bit of an advanced panel, like advanced cholesterol numbers. But even that's not enough. There recently was a study of about 1,800 people that had a heart attack before age 50. That's pretty young. And they asked the question, if we had them in the office before the heart attack, would we have predicted that they were going to have a heart attack? They looked back at their record. And the answer is between 50 and 70% of the time, they would not have been picked up. They would have been known not to be super healthy. Some were smokers, some had blood pressure, but they wouldn't have made a threshold to say, whoa, you're at super high risk, and yet they went on to have a heart attack at a very young age. So test, not guess. Do more. Number one killer of men and women needs to be found as early as possible.
Test, test, test. Thank you, Dr. Joel. And for the rest of you, we're going to see you on one of the next videos. Stay tuned. Stay smiling.